Hi, and welcome to another edition of the Trustcast Show. We're happy to have with us Frank Mayo. Welcome to the show, Frank. Frank started his career on the field as a certified athletic trainer and somehow ended up running clinical operations for a multi location healthcare practice and doing it all while running the philosophy of never miss twice. Frank, what does that motto actually mean to you, and when did you decide it was going to drive the way you run things?
Always more always been kind of something that I could hold on to and something tangible that reminded me every single day to keep pushing. Um, and I thought of this never miss twice mantra and it stuck with me. And it kind of comes in the form of if you're trying to get on a consistent pattern or a consistency, of a schedule, whether that's working out, whether that's dieting, whether that's showing up to work on time, whatever it is, the basis of it is to build up a pattern, right? So if you miss it one day, I wanted to forgive myself, right? You miss the gym because you're tired or you're just not covered or life gets in the way. That's okay. Just get back to it the next day. And that's where the never miss twice comes in. So I try to live that both personally, professionally, in my marriage, as a son, as a, husband, whatever it is, to never miss what I want to be doing twice or 2 days in a row, because then you build a negative habit. I read Atomic Habits, which is one of my favorite books, and I guess
Which
David,
book?
where Atomic Habits.
Oh, yeah, yeah.
So maybe that's where it kind of
Duhigg.
comes from. What was that?
Duhigg, right? Was the author.
Uh, can't remember the author's name. I literally looked at the book yesterday. I can't remember the author's name. It'll come to me eventually, but it was probably born out of reading that, just trying to create habits and a consistent lifestyle. I started living by that, a couple years ago, and it's driven me and it's continued to drive me no matter how hard life gets or what gets thrown in the way. I even made, let's see, buried underneath my clothes here, but I made wristbands, and it says never miss twice. So I'm reminded of it every single day when I down on my wrist. If I look at the time on my watch or whatever it is, I have that right in front of me so that I know, all right, I missed the gym today, which is actually true for me today. And I'm not able to go after this. But I'm going to get back on it tomorrow and accomplish my goals or continue my habits in a healthy and correct way.
So I actually really love that. It resonates with me. I mean, as someone who was, who understand. I mean, I was also an athlete as a young man. I can't say I'm quite the athlete that I was now that I'm more experienced. But
Never are. Never are.
I do know that when was working out regularly, I was really super religious, and now I feel like here's my admission. I need to get back out there. And when I was doing it regularly, I was like super religious about it. I would, anyway. So that really resonated with me. So you came up as an athletic trainer at Loyola Marymount, and then moved into clinical operations. What was the specific moment you realized the business side of healthcare was where thought you belonged?
Yes, so I actually went to Salisbury University, which is also it's in Maryland. And then I was the head athletic trainer at a boys' school in Westchester, Stepinac High School. And I always took an interest to how things were run. Is the back end of how the company I was working for before this job, how was it run? What made them tick? What made them successful? And then when I came over, to this job, I was working in a clinic, a little different setting than being on the field, but same premise. I wanted to know how it was run. I wanted to know the business side of it. I wanted to know about marketing, about the billing cycles, about just the entire ecosystem of the operations. So I learned about it. I dug into it. I had a mentor who always told me that the gold is underneath your feet. So that's where I started, right? I started looking at what was right underneath me as an athletic trainer that I can directly influence. in the operations side of things. And then what I didn't know from that, I would go to other resources and learn. And then I just kind of took off from there. It kind of snowballed, and I liked looking at data and statistics and standard operating procedures of how things are run. And that was about 5 years ago now. And since I've been into the operation side of things, and now I influence daily decisions. And I like the fact that there's a certain point where your two hands are only enough for X amount of people, right? My two hands can only work on X amount of people per day, per week, per month, whatever it is. But if I can directly influence that of a company that has multiple providers now, I can take care of more people. Yes, indirectly, and it's not my hands, but I'm able to take care of way more people than I was as a practitioner working on people myself. So that kind of snowballed, and like I said, 5 years ago, that's where it all started. And since then, I really enjoy it. No 2 days are similar or alike. And it's always piqued my interest, and I think most of all, it's challenged me, which is again probably going back to my athletic background of wanting to be challenged every day, where it pushes me to do better and be able to help more people and help my providers and the marketing team and the billing team, whatever it is under that operations umbrella. I want to be able to help people, and that's really where it comes back down to. At the core of it is being able to help people.
So tell me about New Jersey Sports Spine and Wellness. What exactly do you guys do?
Plethora of things. We're mainly based sports medicine and orthopedic, but we have both conservative and medical. So conservative side makes up it's physical therapy, occupational therapy, chiropractic, acupuncture, sports recovery. We have some athletic trainers on staff who do sports recovery with our athletes, like return to sport. And then our medical side consists of a nurse practitioner who provides in office, usually same day procedures, injections. If there's medication that needs to be given, small doses of medication. And we also have a podiatrist who's a foot and ankle surgeon in the office as well. And then we've also been fortunate to add in um, uh, the sister company of a primary care office as well. So I'm now learning the primary care side of medicine at the same time.
So, what's your typical patient look like? What are they coming in for?
Really could be anything, honestly. More so, like I said, orthopedic based. So, there's a lot of spine related injuries or pains, whether that's low back pain, mid back, neck. A good portion or percentage of our patient population is that. But we also, obviously see anything. It could be, shoulder pain. It could be elbow, hand, wrist, knee, ankle, foot, hip. We see some neuro cases in terms of like post-stroke or Parkinson's, uh, concussion patients. If they suffer a concussion, they can come in and do some concussion specific rehabilitation as well. So like I said, it's mainly musculoskeletal based orthopedics, and we see literally any joint, any bone, any muscle, ligament, tendon, that gets strained, sprained, broken, or just has, pain to it just from everyday life.
So, when a physician opens their practice and immediately realizes nobody taught them any of this in medical school, when you came there, did you experience some of that? Like some of this you had to invent on your own?
I wouldn't say invent, but I would say definitely re-educated. As an athletic trainer, I went through 2.5 years of a master's program, which is accelerated learning, and it was fairly new. Like when I graduated, it wasn't yet to the point where, as an athletic trainer, you need your master's degree. There were still undergrad, so 4-year programs that you can get out and become an athletic trainer. It's since turned over where it's full masters. You need to have a master's in order to sit for your boards and gain a license as an athletic trainer. So, I learned 4 years of, athletic training in 2.5. So when I was on the field as an athletic trainer at my first job, it was all familiar stuff. It was athletic injuries, it was ankle sprains and strains, hamstring pulls, rotator cuff, issues. And then when I transitioned to the clinical side with NJ Sports Spine and Wellness, I worked right in the chiropractic department, which is all spine. So I had to reacclimate to the spine injuries and the spinal rehabilitation aspect of, all right, what does it mean when someone has, say a low back disc herniation or disc bulge, or if, how do the hamstrings attach to the pelvis? And if one's tight and one's loose, how is that corresponding to low back pain? So I had to reacclimate to that side of things.
Mhm.
It's gone in school, but it's not gone in depth in school. So, coming in, I had to, like I said, I had to really learn and put my, eyes in the textbook again and use my resources and gain knowledge on whether it was, you know, online or in person, trying to get, a little bit more educated in the, orthopedic cases that I see with the chiropractic department. So, I had to retool my own mind to structure around what I was seeing every day so that I can do right by my patients and give them everything they could have needed.
So as the COO, how intimately involved are you in the numbers and KPIs and all those kinds of things?
Every single day. Every single day. I look at numbers and data and analytics every single day, and I need to know them because I get asked them every single day by the owner. He wants to know, hey, how are we doing on new patients? How are we doing on this? How are we doing on that? But I think it's an important distinction to mention. As a COO, I've seen other COOs only look at the KPIs and only look at the data and the analytics. I
Mhm.
think it's an important distinction, and something that I strive to do every single day is going into the office and communicating with those that are driving those KPIs, right? So if I'm looking at one of my providers, provider, Susie, which isn't one of our providers, but say provider Susie is having a down month. Why is
Right.
Susie having a down month? What happened? Is there something she needs help with? Is there something she's not understanding? Can I get her more training? Did something happen in her personal life that's not allowing her to reach those goals or those KPIs that we're looking for? So I think it's very important as an executive in any branch, of business, but specifically, what I try to do is just be present, know these people and know who they are and how what they're doing every day is how is that correlating to the data and the analytics and the KPIs.
So when you're in your particular business, I know because I've been an athlete and I went through recovery and physical therapy and all the rest of that stuff multiple times for all kinds of different things, breaking down on the body. But the one thing that you're always striving to do is to drive yourself out of business, so to speak. So that it's just a funny relationship. You have people come in, and your goal is to get them so that they don't have to come in anymore. How does that? uh, it seems like a kind of a difficult concept for most businesses.
Yeah, yeah. Essentially, you got it right. The goal is to, discharge the patient, and as quickly and pain free and correct as possible. And our company, we have a lot of resources, whether it's technology or what we call modalities or treatments, or other discipline, individuals or doctors or PT or chiro that a patient can get to continue their treatment, not completely at a 0 out of 10 pain. And I mean, more, just like I do, no one's really at a 0 out of 10 pain. They're just kind of tolerating it, right? So, we can set up maintenance plans with, chiropractic or acupuncture so that they can continue to get that type of treatment. But you're right. The goal is to discharge, get the patient in, and we work very urgently. We have X-ray on site. We have diagnostic ultrasound on site. So we want the answers, the objective data of these patients and why they're in pain and why they have an injury so that we can treat them correctly and get them from point A to point Z as quickly as possible. So from a business standpoint, it's about the referral sources and the marketing that will then bring in more patients after. And that's what we really focus on as well is, all right, where can we go or who can we connect with or what are we doing online that is bringing in those new patients to then do the same thing, rinse and repeat, right? So get them from point A to point Z, discharge them, maybe get a maintenance plan after that, and then bring in more patients. But that goes back to, my overall goal of helping more patients. So, if we can successfully do that, that's the goal.
So walk me through what happens in the oh no, and that's actually a different kind of question. Are there specific KPIs that you look at in your practice that are the most meaningful to try to diagnose, whether you're hanging your hat on those completely, but to try to diagnose when something, just doesn't feel right?
Yeah, I mean, some of the KPIs, more so, where are our referrals coming? I think that's an important one to know because that kind of tells you the health of the company. And one of the top three referral sources that I see month over month is patient referrals and returning patients. Um, I don't like that the patient's returning because maybe they have another injury or that injury has itself. I'm happy that they trust us enough. But the
Hmm.
patient referrals as well because they trust us enough to send in their family or friend or colleague or whoever it might be to then get treated by us as well. So I always like seeing that KPI of the referral source being at a good level, hopefully top three every single month. Because that, like I said, tells us the health in the company, the health of the company. Other ones I look at are cancellation rate. We look for a lower cancellation rate because we want patients to get better, right? So if they're canceling and they're continuously canceling, they're not getting better and they're not listening to us. Maybe they're Google doctoring what to do or YouTubing exercises that they can do at home. So I like to see cancellation rate being low. Um, but those are two of I think referral sources and cancellation rate that can really tell you a lot about the health of your company. And like I said before, if I see a provider whose cancellation rate went skyrocket, then maybe something's going on with that provider and maybe they need more training, right? Retention rate is another one. I want to see that we're, retaining our patients for the longevity of that, recovery cycle that they want to be or need to be in. Right. So if a doctor's telling you, hey, Zane, you're going to go to therapy for 6 weeks, 3 times a week, you should be, say 70% better, 60 to 70% decrease in pain. I want to make sure that those people are getting that type of treatment or that type of care that they should be getting to get that reduction of pain. To see the retention that's high on a provider or an office, I know, all right, the patients are coming in and they're getting what they need to get better. If start seeing that retention number drop below 80% is our mark, I'm starting to question, all right, what's going on? What can we do better? The patient's just not listening. Maybe there's something else going on out in the world, that's impacting it. Maybe the, economy or there's a holiday coming up. We know summer's coming around the corner, so people are getting excited and want to be outside on the beach or at the pool or on the boat, whatever it is, being so close to the ocean. So I try to take those, into account because like I said, that tells us about our company health.
So I'm going to circle back to the one thing you mentioned earlier was you're talking about if someone, is Susie, the physical therapist is having a down month. Does Susie have to generate her own business, or is she responsible for that, or is it kind of a shared responsibility? And then when I dive into that, well, I have some follow up questions to that too.
Yeah, so, if I'm seeing that Susie is having a down month, we never put that on the provider to go out and say, hey, you need to bring in 10 patients this month, right, to get your numbers back up to a good KPI standard. We have our own marketing team. We have a digital media manager who does all of our videos and pictures and social media, YouTube, all that. So we get our name out there. And then we have a senior marketing coordinator who does a lot with the community. A lot of, going into schools and into conferences and seminars and all that kind of stuff to try to bring in patients. We always welcome provider, ask their patients who else we can take care of or goes in and, is on site for, say a game or a tournament that we're covering that weekend or whatever it might be. But we have our own marketing department, so we don't put 100% of that on the provider because they do have a lot of things to worry about in a week. Notes, especially, unfortunately, a by becoming a provider doctor is that you have to do notes, on the patients in a timely manner. So that's one of their responsibilities, as well as obviously taking care of the patient. So some providers can multitask and do more than others, which is fine. But we're not ever going to tell Susie, "Hey, your numbers are low. Go and get 10 patients and bring them." That's just not who we are. That's not what we're going to do.
So when a new patient comes in, do you just apportion them? Well, some patients referrals. A lot of times they're going to have they're going to want John or Joey or I mean, don't people when they get referred like from a friend, they're usually asking for someone specific. Is that not right?
Yeah, yeah, yeah. I would say so. If it's a patient referral or a friend or family member sending, "Hey, I want you to go see Susie," and we can 100% take care of that. We have a lot of providers in each discipline. We have at least two in both of our offices. So two PTs, two OTs, two chiros at minimum. So we're able to get patients in, and that's one of our mottos is same day, next day. We're able to get patients in because we have multiple providers in each discipline in each office. So, if Susie is all booked up and Johnny, the other PT, isn't, we can see how we can, try to get that patient on with Susie and maybe someone that Susie's seeing that day has seen Johnny also. We can get that patient over to Johnny to make room for that patient to see Susie. Um, so we're able to definitely take care of that. And that does happen time to time. It's kind of on a case by case basis, I would say.
So I have on here servant leadership. There must be a note somewhere here about you talking about that. What does servant leadership actually mean in a clinical environment where the stakes are people's health?
So, from my standpoint, how I see that and my takeaway from that specific is, in my position as a COO, what can I do to help you? Right. And I say that all the time. If you need me, call me, text me, email me, whatever it is. I want to be able to help everybody I possibly can. And is that able to be accomplished every day? No. There's some things that, I can't do in that day, just time basis, or, I'm doing something else or I have a meeting elsewhere. But I want to serve others. I want to serve the people who are driving the business from a hands-on provider perspective, right? So going back to Susie, if Susie needs something, I want to be able to help her with whatever that might be. If it's connecting with the doctor, if it's communicating with the MRI facility to get the report, whatever it might be, however big or small, I want to be able to serve people who, I am the COO for and, help them with, maybe one task, whether that's a task a day, a week, a month, a year, whatever it is. That's really where I see servant leadership coming from. I always say I work for them, not the other way around, right? That's where
Yep.
I lie my head, on that saying.
So private equity is buying up independent practices quite a lot. Is staying independent actually worth it? And what does it take to make that work?
A lot of hard work, a lot of communication, and a lot of combativeness of these private equity firms. Yes, they are going after, the little guys. Um, we've been able to hold tough against them, which is, something to say in itself. And I think it correlates to the type of treatment that we are able to give these patients, not being owned by private equity, being owned by, private. It's a husband and wife. They're both chiropractors, so they both understand what it means to have patients, and they still do. They have very small caseloads, but they have patients they've been treating for 20 plus years come in and still see them. So we've been able to hang tough against it. Yes, it's getting harder every single year. Insurance is not the best, especially nowadays. People see it from a consumer side. We honestly see it from a business side. But like I said, I think it feeds down from the top down, right? And this is something I use when I'm interviewing people is understand who you're working for. Is it private equity or is it private practice where the owners are, like I said, providers and they know what it means to treat patients? Because that's going to filter all the way down, down to the, rehab technician level and front desk level. They're going to feel that, all right, they're all about money. They're all about business. They're all about KPIs and numbers, and they don't care about anything else. Yes, that is something we care about, but we also know what it means to treat patients, right? And that's a resonating point when it comes to especially providers coming to school, is they want to know who they're working for and they want to know that they're going to get that mentorship from a positive angle and not from this, head honcho businessman, private equity firm who is just worried about numbers and hitting their benchmarks, KPIs, and that's it. Like I said, that is of importance because we are a business at the end of the day,
Mhm.
but we also understand the other side of things of what it means to take care of people. And that's an important thing.
So actually, I was going to bring up insurance because it's on everybody's mind who takes insurance. In fact, I talked to some people who just don't even take insurance anymore. So how big of a deal is it, or how much does it affect a practice like yours? I mean, when you're in the rehabilitation, it's impossible for you not take insurance. But how much time do you have to spend messing around with getting reimbursed?
Too much time. Easy answer, way too much time. Yeah, I mean, there are more and more cash-based practices coming up because they don't want to deal with the insurance companies. They don't want to deal with the denials. They don't want to deal with the phone calls saying, "Hey, you paid me X last time and now X minus whatever. What's going on? Like, why is there a disconnect?" And we have an internal billing team that handles all of that. We've been very fortunate enough to be able to have that. Some other companies need to third party that with an external source, and you don't really have the inside scoop on what's going on in those case scenarios. But yeah, it's getting harder and harder. Less and less things are being covered. Higher deductibles are being introduced. Reimbursement rates are going way down. So, it's about evolving. And if you're not evolving as a company, you're going to die. Right. So we have to evolve every single year. So we expect it every year and we look at, all right, what did the year before to this year do? What happened? If the decrease or increased deductibles, let's expect the same thing to happen next year. And how do we combat it? And how do we address that and make up for it in the end? So yeah, it is an unfortunate byproduct of being in this business, but like I said before, if you're not evolving, you're dying. So we have to evolve.
So where do you see New Jersey Sports Spine and Wellness? I'm making up a new name for your company. Uh,
Mouthful.
in the next, pardon?
It's a mouthful.
Yeah. In the next 3 years, what are the plans for the business?
So
3 to 5 years.
we're currently, and I can't divulge too much, just for sake of, being able to accomplish these things without competitors. We're looking to diversify some things, and we're taking feedback from patients and from the community on what they want, what they don't have, and where we can fill in the gap. So we have to evolve and we have to diversify what we're doing as a company in order to sustain growth and continue the legacy that the owners have put out there. I mean, we've been, running for 26 years. I've been fortunate enough to be a part of that for the last six, which is a drop in the bucket compared to the longevity of the company. But like I said, we're looking to diversify and bring on services that we've gained feedback from patients and the community that places don't have that they would like to have and have the ability to go to.
Okay. So, Frank, if somebody says, my back is killing me and they're in New Jersey, it says I have New Jersey and New Jersey on my research here. Does that mean that you're probably in New Jersey? What's your primary area that you cover?
Yeah, so we have two offices. One's in Matawan, New Jersey, which is technically Middlesex County, and one is in Marlboro, New Jersey, which is Monmouth County. They're about 20 minutes from each other. They're pretty close in proximity. But more so we identify as in Monmouth County mainly, which is about, if you're looking at a map, about a half hour west of the Jersey Shore area, the North Jersey Shore area.
Okay. So, what's the best way to get in touch with you guys?
Yeah, so if people are interested in coming in and treating with us, they can get us directly 908-8 No Pain. is a phone number where they can go to the website, NJ Sports Spine and ANDwellness.com, fill out a form fill or a patient questionnaire, and we get in touch with them same day.
Frank, thanks for coming on the show. I really appreciate it.
I appreciate the time, Zane. Thank you very much.